And hello, everyone. Thank you so much for being here. I'm Robyn Haines. And with Breast Cancer Awareness Month in full swing, today we're going to focus on a treatment center that caters to every aspect of a patient's needs. We're going to learn the philosophy behind patient care at the Zangmeister and learn about their on-site clinical trials. And then it's a big day for anyone ready to join Medicare. We're going to share what you need to know as open enrollment begins. Also on the show, creating a marketing plan for finding effective employees and taking on a home improvement project before the holidays kick in. That's what's coming your way today on this all-new Daytime. Well, the month of October is more than half over, and we know this month is dedicated to breast cancer awareness. And I was actually diagnosed with the disease 13 years ago this month. So trust me when I say that paying attention to your breasts, your body, and your health year-round is vital. As we cap off our daytime focus segments, we are turning today to Dr. Jeanna Knoble with the Zangmeister Cancer Center. The Zang and OCAO sponsored our series on cancer awareness. So good to see you again, Dr. Knoble.
Great to see you too, Robyn.
You know, we have for years been hearing the statistics of 1 in 8, right?
Sure.
When it comes to breast cancer, is that still what we're seeing, and what are the risk factors for it?
Right, it is still 1 in 8, believe it or not. It's a very common cancer.
Yeah.
And interestingly, most of them are not associated with a risk factor. So 70% or so, there's really nothing that we identify to be a risk factor, which points out the importance of everyone getting screened, right?
Right.
There are some risk factors, you know, inheritance. So there are some patients, maybe 5 to 10%, that have an inheritance to their breast cancer. So BRCA1 and 2 are the most common. Hormones, so patients on hormone replacement therapy or contraceptive that involves hormones, that can raise the risk of it. Not having children, obesity, alcohol, but really most patients, there's not huge risk factors associated, unlike some other cancers.
And what about treatments then? When we talk about the Zangmeister especially, what kinds of things are you seeing on the daily for your patients?
Right, so there's a lot of new drugs coming out, which is great.
Yeah, that's good.
Targeted therapies that have less side effects and can really hone in on a particular cancer, you know, in a particular patient's cancer. So that's really kind of where a lot of the forefront is: immunotherapy, targeted drugs, oral therapies.
And the patient care philosophy at Zangmeister, how does that differ? How do you think it makes you guys kind of stand out in that area?
I think we're really lucky in Central Ohio to have great oncology care. A patient can go wherever they choose, and I think they're going to get great care. At the Zang, we really try to focus on the patient experience and really making them the center of everything. So, you know, as you unfortunately know, getting a cancer diagnosis is life-changing, right? And it never comes at a good time.
Right, never.
And it's not something that you can put off. So, you know, patients come in and they've got lots of other hurdles and struggles, whether it be transportation, support, financial. You know, we're very lucky at the Zang. We're an independent center, so we're not associated with a hospital system. And a lot of people don't know that hospital system associated care is much more expensive, maybe 40 to 60% more expensive because of things like facility fees. So we're able to offer patients care at less expense, which is another important thing. You know.
And I think it's very interesting, clinical trials, those also can really make or break your care, make a difference, of course, for those that are coming after you. And you guys have on-site clinical trials,
we do.
right?
We do. We're part of the Sarah Cannon Research Institute, and so we have trials of all different disease states. I focus on breast, so I'm the principal investigator for about 4 breast studies that we have. We also participate in NCORP, which is part of the American Cancer Society's, National Cancer Institute's network of large trials throughout the country and in fact internationally. So.
And we know, because you kind of just alluded to this, but I want to talk a little bit about it because healthcare providers are really under increased pressure to reduce healthcare costs, right? That's a big part of what we're seeing, you know, in the changing face of the healthcare industry. So how do you successfully do that at the Zangmeister?
Right, so we do take part in value-based care. So it's really just trying to decrease the cost of doing things efficiently and well. So keeping patients out of the hospital, you know, doing testing that's appropriate, not excessive. And some of that's even shared risk with insurance companies that we kind of share the risk of the cost, which is better for patients and, you know, for the country as a whole.
Let's remind people just about the importance too of self-advocating, of saying, you know, if something doesn't feel right, push for, you know, an answer.
Absolutely. That's so important because a lot of times you'll get kind of the standard answer, and if you know something's not right, you got to keep pushing and just, you know, and it's the right thing to do when it's your health.
And is the age still the same when it comes to the screenings, when it comes to getting those tests and pushing for that?
Interestingly, there's a lot of sort of controversy about that. There's some organizations say 40, some say 45. I tend to be pushing for it earlier because, earlier is
Yeah.
always better. We're also looking at different modalities like MRI for some patients that are higher risk, et cetera.
That are at higher risk. Yeah, and I know that if you get genetic testing, which I said I just had another panel done, thankfully negative, but that can put you in a different category as well. So knowing more, doing more, kind of that is all very important. So any like words of motivation for people as we head out, of Breast Cancer Awareness Month, just about paying attention to their health, doctor?
Right. Do self-breast exams. I think they're important, and get that mammogram at appropriate timing.
There you go.
Yeah.
It's important all year round. Thank you for being here with us.
Thank you for having me.